The reason why we started our project is simply because in clinic we observed the high risk of some thrombosis in myeloma patients, especially already high risk of thrombosis in the precursor stage of myeloma, which is called MGUS, monoclonal gammopathy of undetermined significance, and also the smoldering myeloma, SMM. So in this precursor stage of myeloma patients, they don't need any treatment. They are asymptomatic, but they have a high risk of thrombosis, which make us very interested. And then there are 2 points of that. One point is, in general, if we talk about cancer-associated thrombosis, generally we think tissue factor is the main trigger of cancer-associated thrombosis, because in many types of cancer, the expression of tissue factor is quite high. So, and we know the tissue factor is an initiator of a coagulation pathway. So we think probably the cancer cells which overexpress the tissue factor may be the main reason for the cancer-associated thrombosis. But concerning myeloma cells, we know that's not the case, because the expression of tissue factor in the myeloma cells are quite low, or we can say there is no expression of tissue factor in some myeloma cells. So that makes us wondering what's the trigger, what triggers the myeloma-associated thrombosis early in the precursor stage of myeloma. So this is one point. Another point is if myeloma cells is the trigger, the main trigger of myeloma-associated thrombosis, then in the active myeloma patients, they have much higher numbers of myeloma cells, apparently, but the risk of getting thrombosis is equal higher in MGUS patient than compared to the active myeloma patient. That means myeloma cells, it seems high number or low number, it has nothing to do with myeloma-associated thrombosis. So that makes us have this hypothesis. Probably in the very early stage of myeloma, for example, MGUS patient, the bone marrow microenvironment or the tumor microenvironment for the myeloma cells maybe has been changed already. And the bone marrow microenvironment probably is the main trigger for the precursor stage myeloma-associated thrombosis. So, and then we start our project. Of course, it's a new idea. We need some proof. And we went to a publication. Fortunately, the author has uploaded their raw data of single-cell sequencing. They have a single-cell sequenced the microenvironmental cells in the different stages of myeloma, but they only sequenced the CD45 positive cell group. So that means the immune microenvironmental cells. So very excitingly, we found TFPI, tissue factor pathway inhibitor, and thrombomodulin. These two main coagulation inhibitors was downregulated or transcriptionally reduced in the precursor stage of myeloma and also in the active myeloma compared to the normal bone marrow. So that's very exciting for us. Then we have this poster for ISTH 2022.